candidates for lip procedures. That is not the case. Some people can have lip procedures and they're fine. The prettiest color that I've seen on an African American was orange, straight orange, done on her lips. It heals pink, a vibrant pink. Okay? It was straight orange and it healed pink. Okay? Because of the cool undertones. Okay. So you need to test those colors. Also, there are specialty classes that we have available specific to lips and procedures done over people who have a tendency to hyperpigment. Sherelle has done a lot of work in those areas, and she is a very effective instructor for that. So, which will be available at the convention if you decide to join us then. Okay, questions? Any questions that you guys might have? Yes?
What about the people that have, like real dark and then white blotches?
Okay.
I don't know what
She's asking the question of, what about the people who have real dark and then white areas? Are you talking about vitiligo? Do you understand what vitiligo is?
So.
Okay.
Sometimes they get it on their hands. And
Yes,
that's
vitiligo.
Okay, what about
Okay,
that?
we're going to talk about vitiligo. Let's put it aside for just a minute longer. Any other questions?
I was just wondering if you had somebody that, like a Spanish person, you said that you didn't really worry about hyperpigmentation on a Spanish person that much, but would you put lip corrector in just to be a little more safe?
That is a great question. Thank you for the question. Her question was, if I have a Hispanic client or an Asian or darker skin type, more Mediterranean skin type, even though I don't worry about hyperpigmentation, do I add orange or blue lip corrector or some kind of color that has a lot of warmth to it to compensate for the possibility of hyperpigmentation? Absolutely. Okay. Always use warm colors on individuals who hyperpigment. You can use cool colors on darker skin types, but always add a warm color to it to overcompensate for hyperpigmentation.
I'm not real clear on what vitiligo is.
Okay. We're going to set that aside for just a minute, okay? Any other? Yes?
Do you have them, if you're talking to them and you advise them of the potential of this hyperpigmentation, and they want to do it anyway, do you have another waiver you have them sign saying I've advised you against it, or you just let out don't do it?
Okay. She has a really great question. Her question was, if you have a client who has an issue that is a red flag to you, do you go ahead and do the procedure? Do you have them sign a second waiver or consent and release for that? No, I use the consent and release form that I have, but there's a place on that form that you can add just a sentence, and then you have them initial that. So on that, in that area, somewhere on that form, I simply indicate what my fears are and make sure they sign it. So they understand they fully understand the risks affiliated with the procedure. Okay? So, I've had situations where I wrote on my consent and release form, client wants really ugly eyebrows. And she signs it. If she wants some McDonald's arches, and I've got this screaming indicator that God gave me. God gave us intuition. Listen to your God-given instincts. I am just so firm in believing that it is none of my business what other people want. I truly believe this. The more I mature in life, it is none of my business what other people want. However, it is my business when God gives me this alarm clock that is raging at me, if I choose to do something that is totally against my own value system. So if I'm looking at my client and my internal alarm clock is waving or screaming at me loudly, I am not going to ignore that red flag within me. I am always going to listen to my God-given intuition. I'm not going to allow my God-given intuition to run the show. However, it's about safety. And so I am definitely not going to keep my mouth shut. I will say something. And I will definitely write it down on the consent and release form that we had this conversation. Okay? You know, there are many rules, and of course, after you deal with the public for so long, you get really skilled at these communication skills. And you know, one of the things that I really believe in is just talking about what's going on within me so that I can have peace about the decisions that are made. I want my client to have what they want, but I also want to have peace at the end of the day. So, and when I know my client's in harm's way, I am not going to allow my client to run the show. For example, when my client looks at the lip color and she says, oh my gosh, I do not want orange in my color. This is way too orangey for me. First off, I don't ever get in that situation, but I know that some of y'all do because I see it happening. I can look out the window and here's the technician marching to Premier Pigments. But she's following the client. The client is about 5 steps ahead of the technician. They're racing into the customer service department. Customer service department calls me. They say, yes, I've got a client over here that is really needing to see you about colors. And I'm already waiting for this phone call because I can see them marching to the customer service department. I get over there and the client says, she wanted to put this color on me, and she shows me the bottle of pigment, and she shows me her, she'll give me her pencil, and she'll say, this is the color that I want. If I'm paying $1,000 for this lip procedure, this is the color that I want. She told me to use this color, it's not going to work, okay? And my reaction is then, you know, I don't think that you're a good candidate for permanent makeup. Now the technician wants to shoot me because she wants to pay off her Dillard's charge card or whatever. And the client is over there going, and what the client is thinking is, you mean she's not going to take my money? You know, she's stumped for just a minute. So, you know, it's very effective for you to say, you know, you're really not, you might not be a good candidate for this procedure. And shut up for just a minute, let it sink in. And then I say, you know, Susie is a really great technician and she knows her colors. And this color is really ugly in the bottle. And I appreciate why you don't want to use this color. I wouldn't either. But she also knows that she wants to give you a really good final result. Okay, you can either choose to use a color like this for 7 days and live with it, or not do the procedure, because I'm with Susie. That's generally the way I handle that situation. But Susie made the mistake in the first place, or they wouldn't be over at the customer service department. It's not that Susie's bad, it's just she doesn't understand how to deal with her client. It's about communication to understand the psychology of human beings, okay? And so here's what happens is that if I communicate with my client with lips, and I teach this in the basic class, and I'll go over it really quickly in this class, you ask the 4 questions. What colors of lipsticks do you wear? Do you wear vibrant colors or do you wear natural colors? Do you wear your colors different in the daytime than the evening? Do you wear your colors different in the seasons, in the winter versus the summer? And when you get done asking your client those questions, at the end of that you say, I've got the perfect color for you. And you walk out the door and you become hysterical and call customer service and tell them that you don't know what color to use. You can fall apart outside the door, but in front of your client, you absolutely cannot allow your client to see you waffle in your decisions. So when it comes to choosing colors for any of your clients. The bottom line is you need to be in control, and you absolutely do not give your client color choices. That catalog is for you. That catalog is not for your clients. It's not a good idea to give your clients a color catalog. Now, the reason why we're creating a portfolio for you guys is so that you can give them the portfolio that shows them different options that they may have for procedures, but it doesn't have colors attached to it. It doesn't get in her head where she gets all involved and gets all tweaked if it doesn't do just exactly the way it depicts in the catalog, okay? The portfolio is just really a tool for sales, for marketing. The catalog is not. It's for you, not for your client. Don't make the mistake of giving your client color choices. That is not a good idea. The communication should sound like this during the consultation. It's going to be ugly for 7 days. Remember, in the basic class I taught this, and I teach this every time, exaggerate the risks and minimize the benefits. Always in your consultation. Always. You're going to lose some clients by doing that. Oh well. You're going to have a happy customer base. Okay? I am so blessed in this industry because I get to hear all the horror stories. I get to hear all the complaints. I get to hear all the customers throughout the world who are unhappy because their technician said this and this and this, such and such and such and such. You know, it usually is all about a lack of communication between the technician and the client. Do not tell your client that she can resume her normal activities immediately following the procedure. She may be able to do that, but if she is out to here and she looks like the back end of a baboon, she is not going to be happy at all with you. But if you tell her that she's going to look like the back of a baboon and she doesn't look that bad, she's just not going to be unhappy. Success in business, no matter what business you're in, is about giving people more than what they expect. And how you do that is you lower the expectation in the consultation and you give them more than what that expectation is. Always. You always set up scenarios like that. Always. When it comes to choosing colors, it will take your client 5 days to make a decision between 2 colors. I am not kidding you. And by the time those 5 days are over with, she will become so overwhelmed, she will decide she doesn't want to do it anyway. Okay? So don't give your clients those choices. You need to be in control of the colors, always. Okay? Yes?
What if they come in with a pencil? This is what I want.
Okay. What if they come in, her question is this, what if they come in with the pencil, this is exactly what I want, and they say, this is the color I want. I don't want anything different. This is exactly what I want. My response, you're probably not a good candidate for permanent makeup. Shut up. Let it sink in for a minute. And then you say, you know, I could probably get close to what you're asking. I could get in the vicinity, but I can't promise you that I can get that color. And shut up. And let it sink in. Most of the time, I'm selling the procedure. And when I sell the procedure, I have happy clients. Most of the time. I'm going to lose some. Oh well. I would rather lose some than deal with that woman who said, this was the color I wanted. See this? This was it. Okay? Now here's the thing about permanent makeup. Is very seldom do they get exactly what they want, but very seldom are they unhappy as long as it's in the vicinity. They just aren't unhappy. They get all tweaked before the procedure. There's just something about it. It's like, you know, I'm paying $1,000, so something about that gives them this entitlement that they're supposed to have this perfect procedure. And you need to give them some reality around that. You know, permanent makeup is not a perfect science. The thing I know about permanent makeup, when it comes to marketing permanent makeup, it's difficult. We have this fear barrier when it comes to marketing permanent makeup. It's very scary. Again, it's very intimidating to allow another human being near your face with a permanent marking of any sort. So it's very frightening. But I also know this about permanent makeup. As difficult as it is to get somebody to buy a procedure, it is also very addictive once they get it, a glimpse of it. You know, if you can get a tail on someone, even a tail on someone that has pretty eyebrows. I didn't have tattooing on my eyebrows for years because I thought, you know, I have all this pretty hair up there. And then, and part of the problem with that is every time I'd put a pencil on, it would just be this heavy wax look, and I'd look, wow, that is just way too much. But the color is underneath the hair, so it's really pretty. It really makes a client look younger when you actually tattoo their eyebrows on, even with hair. But anyway, we have all these preconceived notions. But if you get even just a little bit of permanent makeup on a woman, and she gets it, that it's just not that scary, and you know, that it's like an enhancement to what they've got going on, that it's not a replacement for conventional makeup, that they can add colors or take away or whatever by just putting over the top of it. Once they get it, they get all fired up and they want everything done. So we have you know, some challenges to overcome when it comes to marketing permanent makeup. But once you start that process and understand how to market it, it really works out well. Okay. Any other questions about scar camouflage before we move on from camouflage? I'm going to be addressing vitiligo separately. No? Okay. Well, let me talk about vitiligo. Yes.
Molly, is it okay if I use you? She has hyperpigmentation, like a liner around her lip.
A
Now-
pretty one.
Uh-huh. Well,
Okay.
she's got lipstick on right now, but just naturally she does.
Right.
Would she be a candidate for lip procedure?
Yes.
And
Yeah.
how would you go, I mean, would you need to?
Well, I would certainly test you. I would probably test. What does your scars look like, Molly? You don't have any scars on your arms?
Not on my arms, on my legs it is.
Okay. Do you have hyperpigmented areas on your legs? So it's darker. So we would definitely want to test you. She would be somebody I know I could do lips on. It's a matter of finding the color. Okay. Yes?
When you do the testing, do you test it by Q-tips or toothpicks?
No. Testing you got to do
Okay.
procedure.
Ooh, okay.
This, you know,
Thank you.
there's people in our industry who say, well, we
Yeah.
just do color testing by doing a little prick. No,
Okay.
forget it.
It's
The only way to test color is to put it in the skin and let it see how it does. You can't soft play this stuff.
Oh, that's why I get confused. Okay.
Yeah,
Do
no.
you still do consultations with people and do the patch test, or do you normally not?
I normally don't, but I did for years. And when I like to do consultations on people who come to me, you know, I mean, let me back up. There are clients that will come to you as a result of advertising, or clients that will come to you that's kind of a distant referral. Those people, it's really important, I think, to have a consultation. But when you develop a word of mouth situation, they don't want a consultation. Mary told Sally, and Sally's now fired up. She wants to get her procedure done. She knows all about it. She doesn't want a consultation. She just wants to book a procedure. So it is preferable to do a consultation, but on word of mouth clients that are sold before I ever get to them, those people, generally I don't do a consultation prior to procedure. However, I will do a brief consultation before before we perform the procedure. I didn't word that right. But the point is, if they come to me as a result of word of mouth, I still do a consultation. It may not be a different day than the procedure, but it will be a brief consultation prior to procedure to make sure they understand everything. My experience with word of mouth clients is that Mary will tell Sally about the procedure, and Mary will lie to Sally about the procedure, mostly about pain. Does it hurt? No. Mary will tell Sally, this is what my clients tell me, their friends say, and they all do this. Her friend said, oh, you got to go to this famous tattoo artist. She's really good. This girl really knows how to do procedures. Does it hurt? Nope. You don't feel a thing. Now, Sally will get up off the chair, and she will be fired up, and she says, I'm going to kill Mary for telling me about this procedure. She did not tell me this felt like this. She lied to me. But I'll be darned if she doesn't do the same thing the next week with her friend. The very same thing, every time. So, and I really treat these two types of clients differently. The client who comes to me word of mouth has no fear, thinks it doesn't hurt, thinks that she knows all the issues. So she's one that I have to kind of be in your face with, these are the risks affiliated with the procedures and this is what goes on. Usually they're like poo-hooing it. Oh yeah, I know, I've got to sign a consent release. Yeah, my friend Sally said I had to do that. So they, I kind of push them into looking at all the situation because I think it's in my best interest. It's never in my best interest to downplay any risks, including pain. It's not. It's just not. Now, the advertising client, the client comes to me who's scared, who's in a lot of fear, I treat her totally different. I treat her totally different because her fear is not equivalent to what the fear should be. In other words, it's normal to have some fear about this procedure. That's normal. But to be in a great deal of fear about pain, these procedures, would you not agree, are tolerable? I mean, that first pass around the lips, whoa, that is painful. But once that's over with, it's just not that painful. And people come to me when they don't understand and they're scared, and the fear of the unknown is worse than the actual procedure. So when they come to me with that level of fear, then I might manipulate just a little bit to kind of lower their fear level to make it kind of equivalent to what it should be. Okay, yes?
Now, does scar camouflage, does that pertain to stretch marks too?
Stretch marks too. Okay. Now, what I was going to say to you, and thank you for the question. Her question is, does scar camouflage also pertain to stretch mark camouflage? Yes. Okay. But I really like your question because it reminds me of what I needed to say to you, and that is, if the client comes to me and there it is not a definite, obvious need for camouflage, I will not accept that client. In other words, my clinic was in Highland Park. Well, a lot of those women, have a lot of plastic surgery and on and on and on. Okay, but they would come to me and, you'd see this little bikini body pull up her little skirt and say, I want this stretch mark camouflaged. And I'd be over there, I need to get my magnifying glass here. I'd say, honey, if you want to see some stretch marks, we'll show you some.
Wonder Woman.
Huh?
They're just too bored.
Well, when I can't see their stretch marks without a magnifying lens, I am not doing a procedure. When it comes to vitiligo or any type of camouflage procedure, if I can't see where there is a need for camouflage procedures, I am not doing the procedure. There needs to be an obvious reason or need for a procedure or I'm not doing it. Slight color variations are better served with laser, glycolics, alpha hydroxy, hydroquinone, depending on the situation, than what they are with permanent cosmetics. Also, the other rule that I have in my practice is that I don't do procedures unless I know that I'm going to create a good end result. I might experiment with it, but they always know that I'm experimenting with it. And also, if there is a medical treatment that is better suited for my client's situation, I am definitely going to choose the medical treatment. Okay? So, and to that end, even if there isn't a medical treatment, but they have not researched their specific situation thoroughly enough, a lot of times I will ask them to go see the dermatologist or the plastic surgeon and consult with them first before they make a decision to come to me. the rule that I have, and you can write this down if you want, I guess you don't have to, but this is a rule that I have in my own practice. All decisions that are in her best interest are always in my best interest. All decisions. All decisions that are in her best interest are always in my best interest. Always, regardless. You know, in life, it works that way as well. All decisions that are in my best interest are always in the best interest of everybody in the universe. All decisions that are in my best interest are always in the best interest of everyone in the universe. I always refer back to that in life when I've got a tough decision that I'm trying to make and there's other people involved. And when it comes to other human beings, they all have their opinions. They all want you to do a certain thing in life. Some people don't care, but there are those who are close to us who want to influence us in certain ways, like you. Speaking of one particular person, you can't make decisions based on somebody else's desires. You have to let go and let God. And part of letting go and letting God is all decisions that I make that are in my best interest are in the best interest of everyone in the universe. So I always refer back to that, and God always supports me on that deal. Okay? So, yes?
Just one other thing on the hyperpigmentation.
Right.
When you were talking about the vitiligo, and when you've worked on it, and maybe down the line, if you do anything, is there a difference in the healing process or in what they go through afterwards that is unlike, as far as from the sun or staying out of or this or that?
As far as any type of camouflage procedure or just vitiligo?
Well, any type of.
Okay. All right. And I'm going to get into vitiligo in just a minute. Okay. Any type of camouflage procedure, the body heals a little more slowly than the face. Body heals a little more slowly than the face. The face heals very quickly. Okay? Most procedures appear to be healed in 7 days. But I'm telling you, in the basic class, I give you the rules, and you need to stick with those rules. 0 to 40 years of age needs to wait 3 weeks. 40 to 64 weeks, and 60 and up 6 weeks, always. Even though eyebrows look like they're healed within a week to 2 weeks, they are not. If you do a touch-up procedure before they are healed, your client's going to be more tender. It's not going to retain the pigment like it should. And you're just going to have to do it all over again. And you place your client at risk of infection and other various things. So just don't go there. No is a complete sentence. When my client says, I want to get my touch-up, no. If they haven't waited their time, you need to, make them wait their time. Okay? No is a complete sentence. Okay. Let's talk about vitiligo. Okay? Vitiligo is a skin disease like none other. Okay? Now here's the deal, is there's not a lot of research dollars that are given to science for the research of vitiligo. It's really kind of sad. Vitiligo is very traumatic. Very traumatic. Okay? I know teenagers who become suicidal once diagnosed with vitiligo. I've seen that too many times. This is a heartbreaking disease. Now, a lot of people look at me like, are you kidding me? It's a cosmetic disorder. Here's the deal, it's psychologically traumatic. Vitiligo is traumatic. It's not so traumatic if you're a light-skinned Caucasian and you have vitiligo and you can't really tell. It's still traumatic in those cases because those people who are used to going out in the sun and getting a little bit of a complexion are now white. They still suffer depression. But an African American who gets vitiligo is traumatized. The darker the skin, the more traumatic it is. Vitiligo is areas of white or hypopigmentation. Michael Jackson does indeed have vitiligo. I use him because he is really the poster child for vitiligo, unfortunately. You know, I have absolute great compassion for Michael Jackson. I'm not here to judge his pedophilia or his psychological disorders or all the crazy things that he's done in his life. That's not my, you know, who am I to judge him for any of that? I don't know. I don't know what the truth is about him regarding those issues. I do know what the truth is about him regarding his vitiligo. Number one, he's got my pigment on his face. Not that I want to advertise because it's not the prettiest of procedures, okay? And number two, you know, I've consulted with the dermatologist on his case, but he is a victim of a huge lack of understanding about vitiligo. You know, the news media makes it out to be that he wants to be a white person. And, you know, that hurts my heart. And the reason why it hurts my heart is because I understand vitiligo, not because of Michael Jackson, because I understand this disease. And not because I've seen Michael Jackson suffer, because he's done that in private, and he probably is not even aware of the trauma that is messing him up with, you know, whatever. But the point is I see vitiligo, clients who are diagnosed with vitiligo that become seriously depressed. It's your face, it's who you are. Michael Jackson has no more desire to be white than the man in the moon. You know, I mean, I shouldn't judge that, but I'm just telling you that when you go from a dark complexion to big white patches, in his case, he had a severe case of vitiligo. The physicians did the only thing they could do. There's 3 treatments for vitiligo. Depigmentation, like the hydroquinone cream. Repigmentation, as in the case of micropigmentation, what we do. And repigmentation, as in the case of UV light or PUVA treatment. Okay, and then there's various other kind of old wives' tales that people have, and you know, unfortunately, a lot of skin care companies will take advantage of the trauma that vitiligo clients go through. In other words, vitiligo clients become kind of consumed in trying to heal their vitiligo. And they will often go from one dermatologist to the other trying to find a solution for it, when in fact, generally, most of the time, there's really not a cut and dried, black and white solution that is going to be beneficial to them. In Michael Jackson's case, he had such a widespread case that spread so rapidly that the physicians did the only thing they could, and that is they gave him hydroquinone cream to take care of the spots that were left. So he had a few spots that were left, so they gave him hydroquinone cream. Well, you know, unfortunately, somebody in that dermatologist's office leaked some information, and that became this big deal that Michael Jackson did bleaching cream. Well, that was done because he had few spots left. Okay, so anyway, that is kind of, you know, a broad overview of vitiligo. Vitiligo is, well, let me just say this. There are many theories. Physicians have many theories as to what causes vitiligo and what conditions attribute to spreading of vitiligo and that sort of thing. We do know that there are genetic factors. A lot of times the grandparents will have it and it'll skip generations. A lot of times there is genetic factors, but it's not always that there are genetic factors. We know that there was a higher incidence of vitiligo for those individuals who went to the Vietnam War. Some theorize that it's a result of the Agent Orange or some of the warfare, the chemical warfare that was used in that war. I make up, it was just a tremendous amount of stress. We do know that it's stress related, that stress can initiate and aggravate vitiligo. Okay, so, you know, there's many different theories as to what causes it and what makes it spread and that sort of thing. Okay. when it comes to tattooing vitiligo, this is what you need to know. Vitiligo may spread as a result of the procedure. Vitiligo may spread as a result of the procedure. Vitiligo may spread as a result of trauma to the skin, which includes the procedure, of course.
What is the next one?
Vitiligo may spread as a result of trauma to the skin, which of course includes a procedure.
So you're trying to say don't do procedure?
No. What I'm saying is, okay, well, another issue that you need to understand is that vitiligo can be dormant for years and then spread. Vitiligo can be dormant for years and then spread. And my personal boundary that I set during procedure is I ask the question, has your vitiligo spread in the last 7 years? Because many people have vitiligo and it's like they get 1 or 2 little spots and that's it for years. Those are good candidates for us to do procedures on.
Are you always looking for them? For that type of?
No, well, not always, but I mean, certainly, yeah. I mean, if I'm in a situation where I've got a card with me or a brochure or whatever, and I see someone with vitiligo, you know, I approach them.
What if they say they have spread in 7 years? You wouldn't do it?
Then, you know, I talk to them about, you know, the futility of starting a procedure and having it spread all over. My experience is most vitiligo clients are so desperate for any kind of solution that they're willing to go through anything. Now listen, do not aggravate or enhance their fantasy about getting a tattoo procedure. It is not in your best interest to take advantage of the trauma that they have around this. In other words, most vitiligo patients coming to me, most people who have vitiligo who come to me are just about willing to do anything to change the situation. And that's really about their trauma. And it depends on the timing too. Like someone who has just been informed that they had vitiligo, they just got the vitiligo, it's like they woke up one day and it started spreading and they didn't know what it was, and so they went to the dermatologist. The dermatologist said, yes, this is vitiligo. And then they started doing some research. And so usually the first 2 years after they've been diagnosed or aware of the problem is usually when psychologically they are really going through this journey of search for a solution. And a lot of times they'll get into fantasy when they hear that you can tattoo skin color to match their color. They'll get into this huge fantasy of, oh, that makes so much sense, let's just fix it with this. Okay? Don't take advantage of that. Be careful with that. Fantasy is always scary when someone's in a fantasy because reality doesn't always match fantasy, okay? You can talk to them about spreading. In other words, if I'm doing a procedure on someone with vitiligo, I want to do it on someone who has small areas of vitiligo. I don't want widespread coverage and this stuff everywhere because I can't tattoo their entire body. It's unrealistic, it's unreasonable, and it's not healthy for them. Okay? So just don't take advantage of that fantasy. And in fact, because I am so aware that they get into that fantasy, I really work on trying to give them reality. And what I say to them, and these things are important for you to know, is that if I do a procedure on you and we do find a color test that will match, it's going to take more than one treatment. It may take several treatments. A vitiligo may spread. Also, when it comes to color testing, this is important, you might want to write this down. Vitiligo may accept parts of pigment, it may accept all of the pigment, or it may reject all of the pigment. Vitiligo may accept parts of the pigment, all of the pigment, or it may reject all of the pigment. We have to test the colors to know. Yes?
So if you're treating multiple areas of the body, maybe like one area on the face and another on the hand, say the face accepts all of the pigment or pretty much the same tone, could there be another part of the body that accepts none? Like the arm or
Right,
the hand?
exactly. You do have to test various parts of the body. My experience is most of the time it does the same on the face as it does on the hands. You still have to test. Now, I probably camouflage vitiligo on 1 out of every 7 who show up in my office. And that doesn't seem like a lot. It's not. But that 1 out of every 7 who is a good candidate gets a lot of benefit from my procedure. So don't discount it just because there's all these issues. Okay? There are going to be people who come to you that are really good candidates. The woman who has just a ring around her mouth is a good candidate. The, areas on the elbow, bony areas of the body are much more painful than fatty areas of the body. And a lot of times with vitiligo, you see it starting on bony areas of the body, around the knuckles, around the eyes, mouth. Vitiligo a lot of times will start on a man, on his penis. I don't know what it is. It's just whatever. I've done several penis tattooing for vitiligo.
Where would you test? Say they have it on their face, where would you test those?
Back in the hairline. She's asking if they have it on their face, where would you test? Back in the hairline.
So if it went over their own skin color, it would not necessarily be the same.
Well, you want to start testing in the hairline, and then, again, any type of camouflage procedure, I don't test right on the face. Okay. Now, if it's other areas of the body, I test right in the vitiligo. Okay. You're going to have to test in the vitiligo, or it's not going to work. But you start your color testing back here, and then move toward the front. Okay.
Sandy,
Yes.
are there any other skin diseases that you have found that this is very discoloration, like lupus and some that this is very good for any?
Her question is, what about other skin diseases? There are many. Birthmarks, I tend to refer out unless it's a hypopigmented birthmark. I love doing hypopigmented birthmark. Hyperpigmented birthmarks, laser, they're better served with laser. But there's lots of hypopigmented birthmarks that work out beautiful. Port wine stains, they need to first go to the laser surgeon. Now there's some work that some really good tattooists that are going to be at the convention in October are going to be at that are working with port wine birthmarks. And those have been very effective, the studies they're doing. But in terms of other skin disorders, you want to stay away from moles. Any kind of skin discoloration can be problematic. The number one cause of cancer is skin cancer is the number one cancer. I mean, that's the most common cancer.
Is this what you're saying you wouldn't do?
Yes, I would do that.
You would?
Yes, she had hypo. No, that's immediately after and final result. Those aren't exactly the best pictures in terms of being able to indicate to you, but that's immediately after.
Good candidate.
Yes.
Now, what kind of problem, what was that called that she had? Is that what one?
She had no, they didn't show the before. Does that say before and after?
Yes.
That's actually immediately after and final.
Oh, really? So what did she look like before?
Hypo, just big white spot.
White spot, okay, that's.
Hypopigmented area is a white spot. Okay.
People with diabetes are probably have to be real careful.
Okay. Let me talk about diabetics, and we're going to take a break here in just a minute. Diabetic clients vary, okay? You have to ask a lot of questions. Now, if you have doubts, you always want to get a physician's written approval. Now, that's the safe thing to do. I tend to be a risk taker. I'm pretty conservative when it comes to some things, but I know a lot about diabetics, so I know a lot about diabetes, so I understand the disease and I understand a lot about it. You don't want to do brittle, insulin-dependent diabetics without a physician's written approval. But there's lots of borderline diabetics. There's lots of diabetics who are on medication, including insulin-dependent, that are really okay. You know, the question is, how do they react to a surface wound, like a cat scratch or a surface wound? If they have difficulty healing, I'm not going to do them. But let me tell you something. I've been in this business a long time, and I have never, ever had a hemophiliac or a diabetic that has real difficulty healing ever walk in my office. They just don't show up for some reason. I think they kind of know what the deal is. Okay? They just don't come into my office. Now, I've heard people say over the years, yeah, I did have one that showed up in my office. I wouldn't hesitate to do someone on Coumadin or someone who has difficulty healing in terms of eyebrows and eyeliner, as long as I've got a physician's written approval. I would hesitate to do someone's lips that's on Coumadin or aspirin or any type of blood thinning agent of any kind. I would stay away from doing lips on.
Would it be all right if you had them stop their Coumadin for 10 days prior?
It would be only all right if their physician stopped them, not you. Okay? Absolutely. Absolutely.
Doctors won't.
Right. Most of them will not because it's a big time heart medication. Absolutely.
Even
Yes.
with the diabetics, the
Right.
doctors I work for tells them not to do it.
Yeah, absolutely. They want them on those blood thinners. Yeah.
So like eyebrows.
Eyebrows and eyeliner, you're just not going to see a lot of bleeding. Lips are very vascular. You're going to see bleeding almost every time. So, you have to take all of that stuff into consideration. Okay, y'all. Let's take a 15-minute break. Be back at 5 after.
You hit black screen. What's it? Function. Okay, now what I've done is I've turned off the main screen. I can escape out of this. What do you want, the variables that affect color again or something else?
No, I want